Good morning. My name is Manny Sarmiento. I'm president of the Doral Chamber of Commerce, CEO, founder of the Doral Chamber of Commerce. I want to welcome you. Today, we have a very, very special guest. But before we do that, I want to invite you to a very, very special event tonight. We are finally back post-pandemic. We are having Network After Hours today. It should be on your screen right now at La Fontana Restaurant, Italian restaurant. We're going to have a little bit of wine, couple drinks, hors d'oeuvres, and we're going to taste some Viva Casa Tequila Tulum Reposado. We're going to have a great time. We're going to network with people like Pedro and you. So show up tonight, La Fontana. You can go to doralchamber.org, or you see the bit.ly/tasteofdoral30. Join us tonight, 5 o'clock to 7:30 at La Fontana in Doral, 107th and 74th Street. So with that, I want to present our special guest today. His name is Pedro Curbelo from Mind Health Centers. He's a trustee member of the Doral Chamber of Commerce and VP and founder, risk manager. You got a lot of titles for Miami Health Center. Neuromodification theory is what we're going to talk about today. We'll figure that one out. Don't worry. I know it's tech speak here, but don't worry. Let me tell you about Pedro. Welcome, Pedro, by the way.
Thank you for having me.
So Pedro is a founding member of a new and exciting mental health facility that uses a unique holistic approach to diagnose and treat children, adolescents, mental and behavioral health disorders. His life experiences as a father of an autistic daughter, professional experience as a risk manager, entrepreneurial spirit drove him to find alternative healthcare solutions in the mental health sector. And Pedro, you're going to tell us a little bit more about this story because your story is really wonderful. So welcome.
Thank you for having me.
How are you?
I'm fantastic.
Good. Thank you for coming to my show.
It's a good time to be alive, I say.
Good. I wanted to bring somebody with We have a lot of situations right now on this earth. We had this discussion yesterday. I believe a lot of people are feeling depression. I say we practice depression. I practiced depression during COVID too. I say practice depression because if you're practicing it, and you stop practicing, then you're good. Right. But it takes a little more than that. You're going to tell us about that.
It does take a little bit more than that.
So tell us about your history. How did you get to Mind Health Center?
Man, it's been in the making for 44 years. It started with me as a child and my childhood experiences that later on turned into fatherhood is what helped me understand the business that I'm driving. So mental health disorder affects everyone, and I mean everyone in the community, especially if you're a parent. Once you're a parent, a lot of things happen to the mind, new experiences, new coping mechanisms, combined parenthood, young parenthood with childhood traumas, and now new life experiences. That is easily a formula to create a mental health disorder. That was my experience, and my experience personally, having a child who suffers from autism and understanding what autism is and how to manage her cognitive disorder helped me understand how I'm going to help the community. Many things happened in my life that led me into healthcare. About 15 years ago, I learned the healthcare delivery system. I learned how to manage risk in the healthcare setting and how to deliver an effective care coordination mechanism to better the lives of those who I was serving at the time. So all those experiences, my fatherhood experience with a child suffering from a mental health disorder, my own experience with suffering from childhood traumas, and my professional experience in delivering a quality healthcare has led me to create Mind Health Centers, which is it's a mental health clinic, but we use all the latest technology to diagnose and treat children. And the children have adults around them, and they have adolescents around them. So it's evolved into the whole family unit getting mental health solutions to their problems. And it could be short-term problems or long-term problems. So in a nutshell, we are a very good mental health clinic doing things completely different to what our peers are doing. Non-traditional and traditional combined with technology. And we've developed this neurological modification therapeutic technique,
Wow.
which
Definitely,
we'll go into
wow.
it a little later.
Yeah, I want to get to that, but I don't want to get too far forward before we define what is a mental health disorder. And it's I'm concerned about the misdiagnosis, especially of our
Happens a lot.
kids.
Happens
So
a lot.
what is a mental health disorder?
A mental health disorder is when your mind, it's not working to what social norms are. It could happen clinically, meaning you have a brain that's chemically imbalanced, and you now need to be medicated to balance that chemistry in your brain. Or it could happen through traumas. And traumas don't necessarily mean something shocking. It means changes. Um, any drastic change in a child's life could create a mental health disorder. For example, anxiety, in my opinion, and what I'm seeing in the clinic, is the true pandemic, because anxiety creeps up in children, adults, teens. It doesn't matter. It creeps up and it develops into depression. It could develop into attention deficit disorder. It could develop into attention hyperactivity disorder. And these are not necessarily um, chemically imbalanced brains. These are emotions that haven't been dealt with, that have built up into an anxious state, and from there has transformed into now mental health disorders.
So you're saying it could be chemical, or it could be part of and they call it environment, I guess.
Yeah,
And what the child has gone through.
absolutely.
Okay, now is there? And I don't want to repeat this in a question in a way. I don't want to ask this in a way that I skew the question, but I'm going to skew the question. I believe that there's a lot of misdiagnosis.
I agree.
A lot of pill pushing. Is that
Well, it's the norm. The healthcare delivery system in America does not have a protocol. So as the professionals go into the work state, they follow what they were taught by those clinical experiences they had in their classroom setting, which doesn't have a per se protocol. Now, I'm talking about the delivery system. I'm not talking about the treatment system, meaning the care coordination and how one professional clinician and another communicate with each other to determine, is this the proper diagnosis for this, in this case, child? Is this the proper diagnosis for this adult? The way mental health, and which is the industry that I'm in, is currently being diagnosed is, I'm feeling something, right? And you don't know what you're feeling. And let's say it's your child and you see it in misbehaving. Your child is now acting out. You go to the doctor, you go to the primary care doctor. Now, the primary care doctor, it's not necessarily trained or educated in diagnosing a mental health disorder. They can recognize signs, and now they're going to say, well, you need to see a psychiatrist, you need to see a psychologist. So you as a parent are now in your network of providers by your insurance, finding most likely a psychologist, or you saw an ad online or someone referred you to that psychologist.
Wow, look at this. We have a question already. Okay,
great.
Can
We'll
you
answer it.
Yeah, that's good. That's can you explain what kind of therapeutic technique you are mentioning? Is this only for children with autism? What about adults with middle dementia cases? Is this a nonprofit or a private business? She's got a lot of questions.
She does have a lot of questions. Do you want me to answer it now, or should we continue?
No, let's. Why don't we answer?
Let's answer
briefly.
It. All right.
I do want to go through these questions. We put these together.
Got it.
But these are good questions.
Well,
I want to know about you. That's good.
Yeah, that's amazing. Or the therapeutic technique we named it Neuromod, which is neuromodification therapy. What we are doing is modifying and regenerating the neurological connections in the brain. Now, we did not invent this. This has been around for at least 30 years. However, it's not popular because it's not the norm, because it's not prescription medication, because it's a holistic treatment. It's a highly advanced technological holistic treatment or technique that is FDA approved. So
Oh, it
this,
is F-
yeah,
so that's
absolutely, yeah,
important.
absolutely.
FDA approved,
Everything we do is FDA approved.
but it's not
It's not
pills.
prescription.
Is it like a biofeedback?
It's kind of like it's a combination of biofeedback and brain balancing. What we're doing is, depending on your condition, whether it's a mental health disorder or just a executive or executive performance condition or a athletic condition, meaning you don't have a mental health disorder, but now you're an athlete and you're going through a slump, you can't hit the ball. Well, that's not a mental health disorder. You're just going through a period in your life where, I'm not 100% focused. This technique helps with that. Same thing academically or at executive level. You're a high performance CEO and you're like, something's happening where I'm not at my peak. How do I get to my peak? Well, most people get to their peak because they learn certain things or they go to the gym, they take care of their body, but that not really taking care of their brain, of their mind. So what we do is we adjust that, how the brain functions at the neurological level.
But this isn't you have actual psychologists.
Absolutely. This is performed by a team of.
I want to make sure it's
absolutely. This is performed by a team of clinical psychologists or neuropsychologists and neuropsychiatrists. We have both on board.
What's the difference? Psychiatrist, psychologist, because
the psychologist treats the mind. The psychiatrist treats the brain. The mind are the emotions. The brain is the functionality. When you get those two in the room together, now we have a full understanding of what's going on up here. Because one, it's an expert on the feeling aspect of the brain. The other one is an expert on the actual chemically balance of the brain. So I've sought out and hired both teams to properly diagnose, to say, okay, does this individual suffers from attention hyperactivity deficit disorder? Does this person suffers from depression? In this case, the question in the audience is middle dementia cases. My answer is yes. It also treats middle dementia cases. Now, this treatment was designed to aid or reduce the doses of prescription medication. In some cases, completely eliminates prescription medication, depending on the patient and how they respond to the treatment. And what the treatment is microwaves going through your brain, less than the cellular microwaves when we talk on the phone.
So you're not going to fry my brain.
We're not going to fry your brain.
Okay, good.
It's 100% safe. It has no side effects. It's a 30-minute treatment and you go home. It could be done a couple of times a week. It could be done a couple of times a month, depending on the patient's condition and how they respond to it. And there is a adjusting period of it. So once you're diagnosed, we hook you up to the machine and we adjust the frequency, we adjust the consistency in what areas of the brain we're going to treat.
Is this controversial? Some people are going to say, "Oh, you're going to hook me up to a machine, and that's going to cure me or cure my kids."
It could be controversial if you are completely against alternatives. If you are a clinician, it's like, listen, I believe in prescription medication, and you are a pill pusher, obviously this is going to be controversial. That is not who we are. We are looking for solutions tailored to our clients
and results.
Right. So, if I have a patient that is schizophrenic, this might not be for them. This is a chemically imbalanced brain. This is something that There we go. Good question. What percentage of effectiveness?
She's got a great question. Sandra, you got a
Well,
lot of great
the
questions.
percentage of
I got to bring you on the show next
effectiveness-
time so you can help us interview.
The percentage of
Percentage of
effectiveness
effectiveness, yes.
varies, right? It could be up to 70%, and this is based on studies and patients' responses. In some cases, I have a recent case. I came into the clinic with depression and insomnia, and she was medicated for both. About 12 weeks later, no more medication.
Wow.
The individuals, listen, I'm fine.
When you're talking about medication for
Prescription
for
medication.
description, you're
Yeah.
talking about Xanax, Valium.
Yeah, all the
Those things are
norm.
harsh, aren't they?
They are. They take a toll on your body. They take a toll on your liver. These are prescription medications that are designed for you to be on it for the rest of your life. See, prescription medication, it's not the cure. It's a solution, but it does not cure depression, for example. It eases your depression, but there is no clinical depression. There is no cure. I got rid of depression. There is a combination of things you could do to reduce it to a level that is not affecting your daily life.
Mhm.
But prescription medications, in my professional opinion and personal opinion, it's not the answer all the time. And that's what we're looking. So answering to the question here on the middle dementia cases, yes, it does treat it. There's many cases out there of slowing down dementia. It doesn't get rid of dementia. It slows it down. It is, studies do show that this therapeutic technique regenerates the connection in the brain. So it's regenerating the dead connection between neurons.
What's it called again? What's your technique called?
The technique is biofeedback or neurofeedback in combination with SAGE, which SAGE is a laser balancing of the brain. So we use high-grade medical lasers to balance the left brain and the right brain. There's two things that happens in the brain when you have a mental health disorder. One is the connection of your neurons, neurotransmitters, right? So how they're connecting, whether it's a dead connection, and that's usually where mental health disorder happens. There's an area of your brain where these neurotransmitters are dead. They're not functioning. Well, our brains is designed to regenerate that. Well, what prescription medication does is they spark that up again, but it does it as long as you're taking prescription medication. So once you're off prescription medication, there's no spark. What this technique does is regenerates that dead area. So there's a new connection being created. Once it's created, it's functioning. There's no need to continue on with the treatment. Our goal is to discharge you after we see success.
So the effectiveness, to answer the question from Sandra, the effectiveness is high?
It's high. It's I have to say, because of legalities, 70%, because that's what study shows. But I'll tell you what prescription medication.
FDA studies, 70%.
These are many studies. The FDA did not give it a percentage of success. What the FDA did is they approve the technique and they approve the equipment where we use the technique. So the technology per se.
But the studies are out there. And
the studies are out there.
Look up the studies.
You can look up the studies.
Okay.
I am not the only shopping town providing this. However, I am providing it in a unique setting, right? Where I'm combining traditional methods, traditional psychotherapy methods with the technology of biofeedback or neurofeedback and the technology of balancing of the brain. So post that, we go into, now you have new connections. Well, let's balance left brain and right brain. And I can go on for hours on how we do it.
Okay.
So I invite anybody who wants to see it, they can come to the clinic and actually, see how we treat those procedures and see for themselves that it's 100% safe.
Let's be clear. You are not a doctor.
I am not a doctor. I'm not a clinician.
But you're the founder, and you started this. You really did. We didn't really tell, and you've told the story. You told me the story. I know last time I interviewed you, you told the story. Please tell us a story of how you really got to this and your You kind of mentioned at the beginning, but I want you to get more detailed on that, because I think a lot of
Do
parents
we
are
have time?
suffering. Yeah, we've got
We
time.
have time?
A lot of parents are suffering exactly what you went through. Um, I I have family members too, where we had the challenges in the family. I had a family member who committed suicide,
Yeah.
which is very sad. And I think the media is covering up what we're really having today. It's a lot of depressed kids. If you haven't seen Dear Evan Hansen, you got to look at that. Don't I would not let your kids see that movie, but it's about depression.
Yeah. Yeah. The depression is a silent killer.
Yeah. So tell us your story.
Young father, I'm going to start there, right? Because
Yeah,
I
please.
can start with my story and how I got into healthcare, but I don't think we have enough
No,
time.
no, no.
So
I want the personal, if
the
you don't
personal, yeah,
mind. Okay.
absolutely.
Because I think that's what parents are suffering through. A lot of parents. I believe. I'm not a doctor either. I don't do studies, but I kind of feel it, and I see it in people, in the way they talk, when they come to our office, when I talk to people, that they're having challenges.
This is how I first go into healthcare, and that part of my story is so important because it's part of why I'm here. About 15 years ago, about 17 years ago, my father got misdiagnosed with cancer 4 times.
Wow.
Died young in his early 60s, because there was not enough time to treat this cancer. Now, the cancer would have been treatable, and his survival rate would have been 80% or higher.
Also misdiagnosed, but he actually had cancer.
He had cancer, but was misdiagnosed 4 times. So
Wow.
by the time the proper diagnosis got there, too late. 6 months, he's
Wow.
dead. That infuriated me. And I went into the healthcare industry to make a difference. And I did in that time. And it was for patients similar to him. Fast forward a little bit, I'm now a father of an autistic child that I don't know that this child is autistic. I know her behavior is not normal compared to her siblings. And I know that something is different, something is wrong. So, what do you do as a parent? You take your child to the pediatrician. And the pediatrician's like, well, she's fine. There's nothing wrong with her. Well, I think differently.
Mhm.
Well, yeah, no, listen, she's fine. And we go back to the pediatrician. Same thing. She's fine. Now, my child is 3 years old. She's nonverbal. She can't speak. Says 2 words.
At 3?
It's just not normal to me.
No.
So now it's like, well, you need a speech pathologist. So we talk to a speech pathologist, and the speech pathologist says, well, your child, you're living in a bilingual home. Choose one language. Get rid of one language.
That's the answer?
And that was the answer, right? But she's fine. Now, all this time, my child was autistic, right? So finally, I record her behavior and I show it to the pediatrician. And her behavior was hand flapping, where it looks like this child is having a seizure, but I know she's not because I'm used to seeing that behavior. So the pediatrician's like, oh my God, she's having a seizure. I said, well, no, she's not having a seizure. I know what a seizure looks like. I'm in healthcare. That's not a seizure. I don't know what it is, but it's not. So we get referred to a psychologist or a psychiatrist at the time. And within 3 minutes, this intern says, your child's autistic. I couldn't believe it. I'm like, well, she's not autistic. Let me take her to a place where they could properly diagnose her. And she was autistic. I chose not to believe it at the time. That wasn't a misdiagnosis, but I took her to a place where they diagnosed children on the spectrum, and she was properly diagnosed. But it took me almost 2 years to figure it out. Once she was diagnosed, the treatments that she received and the setbacks that me as a father and as a family I went through, from financial stress, because there were things that my healthcare provider would not cover, and etc., was so difficult and challenging that I said, there's got to be a different way. But at the time, I wasn't ready to build what I've built so far. So time went by and I went into another industry. I went into aviation, and I had success in aviation, and I thought that was the industry for me, until COVID hits. And then COVID hits and I start seeing it everywhere.
Mhm.
I start seeing people screaming out for help, and all kinds of mental health disorder, and an opportunity presented itself where I could be part of a clinical setting on a mental health clinic. And I said, well, the only way I could do this is if I can make a difference and I can treat people with my history. And my history is having an extremely difficult time doing the care coordination and the care of an autistic child, in addition to other things that were going on in my home. And that's why we treat adults with depression, bipolar disorder, dementia, you name it, any cognitive condition or mental health condition, we treat. Mind Health Centers was birthed out of, wow, this is hurting me. How many other people are going through this? The world is. Wait a minute. There's an opportunity here.
Yeah,
I am a for-profit, by the way. She asked if we were a for-profit, nonprofit.
There's nothing wrong with that.
I am a for-profit. There is a nonprofit component to this, because I have a nonprofit company designed to provide the gap, to cover the gap. Those who cannot properly receive care because of financial reasons or other means, then the nonprofit will aid to as much as we can. There is a limit because we're a young nonprofit, so we don't have all the funds in the world, but we will eventually.
But there are a lot of resources.
There are a lot of resources, and more than that,
especially for our kids.
Yeah. More than just a mental health clinic, we are a resource center. So we will guide that parent, we will guide that adult on single treatment of what else is out there that we are not providing. And actually, my mission, it says that we're here for clinical collaboration. I'm not here to compete with anybody. I'm here to better the community.
You were working with one of our trustee members, also our board member, Gadi Merida, with the New Way Day Services.
Absolutely.
She has a school, and she's ramping up and building up her school for children in the spectrum. And you're working together with her, which is great. And she's got a nonprofit also to help. As with as little time as I've known you, I think 3, 4, 5 months, I've seen who you are.
I'm passionate about what I'm doing.
Love your story.
Everything has to have a meaning for me, right? If it doesn't have a meaning, I don't get involved. And this is my life work. So I've been blessed enough to have partners, because that's why I'm a founding member. There's other members of this company that understand and follow my lead in how to better care for the community that we're serving.
But then look, let's talk about a marketing tip right now. And this is one of the things I tell everyone: you have to care.
Absolutely.
Your job and your company is not to sell anything to anybody. It's to provide value. And what is that? What is that value you provide? This is what we do at our chamber. Everybody has, as a Doral Chamber of Commerce, everybody has my cell phone. You call me on my cell phone.
Yeah.
We give I contact, everybody signs up. I contact them. I mean, within a day, I'll call them up. They get surprised because of that service. And this is what you're doing. We've been talking about marketing and we're helping you marketing. You're doing the marketing that's necessary. Coming out here, giving this information. You didn't come here just to market your services. I brought you here because I know you're going to give some great information in 30 minutes. We got about 5 minutes left. So thank you for doing that. Thank you for who you are.
Thank you.
I can see. I've seen your heart. I've seen that you care, and that's marketing, by the way. That's the biggest marketing there, is caring and really providing. People will talk about you, top of mind awareness, and then people talking about you and what you do. So two quick more questions that with the time that we have left. So let me reiterate this. You claim that depression can be treated without prescription medication?
Absolutely, yeah.
Okay.
Depression can be treated without prescription medication. I have seen it work.
Okay. Well, you know what I told you, right? During COVID, things are challenging for everybody. It was challenging for me. I felt it. I think that 90% of the population was depressed. So the way that I focused on it was, and I think I said it earlier, is I, instead of saying I feel depressed, I say I'm practicing depression.
Yeah.
Okay. And
that's a good one.
And I've seen it in family members and stuff too. And because I believe, first of all, awareness. I believe that you need to go out and sometimes you need to go and ask for help.
Yeah.
And sometimes it's as simple as having a family member or a friend that you can go to and have a conversation with and getting assured.
Yeah. Initially in the show, I said I don't know if I said it in the microphone or I said it before, that it's a great time to be alive.
Yeah.
It's a great time to be here because now mental health is acceptable. So the great slogan of mental health is okay not to be okay. And that's the opportunity that I saw in the industry, because I can reach out to the masses and they're not going to feel, what?
Yeah.
I don't have a problem. Listen, we all have problems.
So
From
important.
stress to any other heavy mental
Stress.
health
You want to
disorder,
talk
right?
about stress right now? I mean, rent prices, gas prices, violence in the streets.
There's a saying out there,
it's
there's
crazy.
a thin line between love and hate, right?
Yeah.
I say there's a thin line between stress and anxiety. And anxiety creeps up into multiple forms of mental health
And
disorder.
it affects you
So
physically.
understanding what you're feeling, just understanding who you are mentally,
what a
could
great point.
change your body completely.
What a great point.
Yeah.
Once
you know who you are at a core and you live in the present and you heal whatever is hurting you, everything will change around you.
I think awareness. What I feel is it's awareness and not denying it.
Mhm.
You feel depressed. You feel depressed. And if you can't, if you try borrow my technique. Okay, I feel depressed. Okay, no, I don't feel depressed. I'm practicing depression. I'm practicing anxiety. Why? I'm just practicing.
I think we're all practicing anxiety.
It's all over. Okay, let's talk real quick. Do you believe? Just a quick one more question here. Do you believe that the violence we're seeing today, that's been ramping up today, is preventable with treatments like?
Absolutely. I think if we as a society take the time to understand young people, the children, and change their behavior and help the parents understand themselves to change their behavior, we could have a better quality of life at the family unit. Therefore, those children who are raised by parents who are not abusive, by parents who are inclusive in the children's feelings and are proactive and are community, part of a community, will definitely lead those children in not having time to be violent, because violence starts in the household. Violence starts in the neighborhoods.
Mhm.
And those are families that lives in those neighborhoods, that lives in those households. So counseling changes that. And as I say, understanding yourself changes that. So let's change the family unit. Once we change how the family unit interacts with each other and they interact in the community from an understanding point of view, we will then eventually transform our violent canvas. We live in a very violent world. And this is because you have these kids that grow up to be teens that are unsupervised and they're raising havoc. I mean, we see it in South Beach every year.
Yeah.
We see it in the news every time.
Yeah.
This could be prevented through the whole community joining in and say, hey, I recognize it takes a village, right?
Yep.
I recognize this family is not okay. How do we as a community help that family?
Great. Awesome.
And we can save them all, but saving most would change our society.
Wow, I love it. Thank you for saying that. All right, I'm going to put you on the spot. I typically prepare people, but I forgot to prepare you for this one. Michael Miller. Oh, by the way, thank you, Michael Miller, Grant Miller, the entire family, our producer, new producer, Elian. Thank you so much. Carmen Lopez, our vice president, all of our trustee members, including Inside Street Media. Miami's Community Newspapers is a great place for you to market your business. Come on this show. Come on, talk to Michael or Grant. This is a place to market your business. So with that, Michael loves to finish. For me, he's asked me to finish up with this every show here. If you're talking, I want you to look at the camera.
Yep.
And I wanted to tell our teens. I want you to give our teens a vote of motivation as to how to live a better life or be a better person. So you talk to the camera right there.
Teens?
To put you on the spot there.
All right. You don't have to be like your father or your mother. If you're feeling pain, that pain could be soothed. And that has a solution. And it's understanding where you come from to then be guided to where you're going. So if you are living in a time of confusion, there is clearance. There is a clear pathway to success, to happiness, to inclusion. As a teen, you don't fully understand what's going on because your brain is not yet mature to process everything. But there are people in the community, like our center, that can help. And I'm speaking to the parents of those teens too, as I was the parent of a teen, as I once did not understand what truly was going on in my teen's son's mind. I wish I would have had the information then that I have now to be able to help my teens who are now young adults. So speaking to you, the parent, and to you, the teen, there is assistance out there for you to live a better quality of life. And if you're living that great quality of life, continue and empower others. Volunteer in the community to be an example of those who need your guidance. That is my message.
That was awesome. By the way, teens, you're not too young to help others.
Yeah.
Give back to the community. Awesome. I want to thank Curbelo Mindhunters, VP, founder, risk manager. My name is Manny Sarmiento, Doral Chamber of Commerce CEO, president. Thank you. Go to doralchamber.org. I hope you can join us tonight at La Fontana, 5 p.m. to 7:30 p.m. for our business after hours. And thank you so much. God bless you all. Have a great day.